Hey everybody, Ashley here with Charlie and the Crimson Man. We're going through the digestive system anatomy in this set of videos, good for studying and for prepping for class. So I'm going to start off with this section on the kind of basic anatomy related to the oral cavity, the pharynx, and the esophagus. And we are going to zoom in on part of the Crimson Man because this one is just so nice the way it's divided apart. So of course, externally, we start with the lips. From there on the list, we're going to move to the tongue, and then we're going to move to the hard, and as we go back into the soft palate. Together, all these structures, of course, are going to make up the oral cavity. Next on your list, you have the regions of the pharynx, which we've covered extensively in the respiratory anatomy, but you have the naso, the oro, and the laryngopharynx as we come down through. The next structures on your guide are the uvula and the epiglottis. So you probably remember that, of course, your uvula is what dangles in the back of your throat. So you remember that that would be then right here at this tip versus the epiglottis, which we've talked about in relation already to your respiratory system. We can see that this little projection then sticks out here past the trachea. Next on our list, we have the esophagus, which extends towards the back. The only mistake I could see happening is confusing the trachea and the esophagus, so make sure you know that it's running here more towards the back, towards the dorsal aspect. Next on the list are some glands. Now the glands are just beautiful on this Charlie model, so we're gonna go to this one. So here you should be able to see, and I'll zoom out so you can see where I'm looking. So we have right below the mouth, and then we have right below the jawline. We have two of these glands. And if you look at your study guide, you have what is called the sublingual and the submandibular glands. So the sublingual, number 5, submandibular, number 6. You do have a view of this gland, but I think it's really nice on the other side, so I'm going to sneak on over here. The last one is going to be that parotid or salivary gland, and you can see here how that's indicated with D4, and you have some ducting that's going to enter in, and of course that's going to be really important because that would travel all the way here into the mouth, into the oral cavity. All right, that was a relatively short video, but those are the major structures from that section.